Have you ever noticed a new spot on your skin, or perhaps one that just looks a little different than the rest? It is natural to feel curious, and perhaps a little concerned, about moles that stand out. Understanding what makes a mole unique can be a powerful step in taking care of your skin. Yes, atypical moles do usually appear larger than regular moles. While there is no single size that defines an atypical mole, they are often notably bigger than your average common mole, frequently exceeding 6 millimeters in diameter, which is about the size of a pencil eraser. The reason for this size difference, along with other distinguishing features, lies in the growth pattern of these moles. Common moles, known medically as nevi, tend to be small, symmetrical, and have uniform color and borders because their pigment-producing cells, called melanocytes, grow in a very organized way. Atypical moles, also called dysplastic nevi, have a more disorganized growth pattern. This irregular cellular arrangement often leads to their larger size, as well as their characteristic uneven borders, varied color, and sometimes asymmetrical shape. They are benign lesions, meaning they are not cancerous, but their unusual appearance can make them resemble melanoma, which is why they warrant closer attention. When you are checking your skin, keep an eye out for any moles that are growing or are larger than 6 millimeters. The most effective approach is a regular self-skin exam, where you methodically look at all areas of your body. Remember the ABCDE rule: A for asymmetry, B for irregular borders, C for varied color, D for diameter larger than 6 millimeters, and E for evolving or changing over time. If you notice a mole that fits this description, or any mole that is new or changing, it is always a good idea to have it checked by a dermatologist. This proactive step helps ensure any concerning spots are evaluated professionally. What makes these larger, irregular moles particularly interesting is that they can sometimes be markers of an increased risk for melanoma, especially if you have many of them. Think of them as a friendly heads-up from your skin. Recognizing these differences empowers you to be an active participant in your skin health. While a larger size is a common indicator, it is truly the combination of several irregular features that dermatologists look for when assessing an atypical mole, often referring to a mole that stands out from your other moles as an ugly duckling sign. By understanding that atypical moles tend to be larger and have distinct features, you are better equipped to monitor your skin confidently. Regularly checking your moles, knowing what to look for, and consulting a healthcare professional when something seems off are all essential steps in protecting your skin and maintaining your overall well-being. It is about being aware, not alarmed, and taking charge of your health.